patients that have identifiable mutations that are on targeted therapies develop resistance. We know the same story rings true for patients who are on chemotherapy. I think maintenance is important for patients who are receiving chemotherapy. I think that maintenance discussion has to happen at the beginning of treatment, not when you're ready to deliver maintenance. And we've seen obviously improvements in PFS and OS with this strategy, but even with patients who receive maintenance, they will progress at some point. And outside of a clinical trial and outside of immunotherapy, maybe you can walk us through your treatment approach, given your work in the second-line space with docetaxel and how you approach these patients.
So we have data on at least several drugs, because we have data on docetaxel alone, on erlotinib, on pemetrexed. We have data on the combination of docetaxel and nintedanib. We have data on the combination of docetaxel and ramucirumab. And now we have data also on the combination of paclitaxel, weekly paclitaxel and bevacizumab. We can say that anti-angiogenics work, and we can add also anti-angiogenics in second line, and nintedanib and ramucirumab, more or less. My feeling is that comparing the other ratios are more or less the same, so you can discuss with the patient if he prefers an oral treatment or an intravenous treatment. And also now there is also the option of bevacizumab. What the perspective of the European and the Italian situation is that we have also to see the clinical relevance of the benefit, because also for the economical crisis, we have to know if we can have a small benefit for all patients. And I think that chemotherapy will not die also in second line, because also immunotherapy will not for all the patients, when we will understand maybe in the next years who are the patients really benefiting of immunotherapy.
So if you're not using an immunotherapy, and I would argue that immunotherapy is certainly cemented as a second-line treatment for those that are immunotherapy eligible, is your go-to regimen docetaxel? Is it docetaxel plus ramucirumab? We have now data coming out tomorrow looking at weekly paclitaxel with bevacizumab, showing an improvement in response rates versus docetaxel. Where do you sort this all out in your mind?
So if you have in first line carbotaxol bevacizumab, maybe you may have also pemetrexed, which is, I think, more feasible than docetaxel. Otherwise, in my opinion, although the hazard ratio of paclitaxel plus bevacizumab seems higher, seems better than the other two combos, I think that more or less all the three options are the same.
Okay. Any other perspectives from the panelists? How we approach second-line patients that aren't getting immunotherapy, dosi, ram, dosi? We have a lot of competing strategies here. Mark, your thoughts?
I have no patients not getting immunotherapy.
Right. So
well, then I guess third line, right?
Yeah, yeah.
Comes third
so
line.
maybe we should say this is a not eligible for immunotherapy second line or third line.
I pretty much agree with Marina on everything she said there. I think just one thing I do want to bring up, though, I'll again say I think giving an EGFR TKI in that setting is not something that it can be highly recommended. They're FDA approved in a couple of situations. However, in this targeted therapy milieu, and if you follow the ASCO guidelines there about choosing wisely, you don't give targeted drugs to people without the target. And I'd urge people to back away from that, particularly our European friends who did it a lot. And if you're tempted to do it, that might be a place for that Biodesix test.
Yeah, the Veristrat.
The Veristrat, because at least it would tell you, it would keep some people from getting that drug. But I'd be really, I'd stay away from that. And we have so many other better choices now. I think that was Marina's point.
Yeah. Govindan, your approach to this?
Same thing. I tend to use docetaxel as a conventional option, and I've not used much of ramucirumab, but I think I agree with all the points made here.